Hey everyone, welcome to my first ever Google Hangout. This is Sex Ed 2.0, hosted by Flair.com. So for the next half an hour, we're going to go into all the questions that you wish you had asked during your high school sex ed class. And if you're like me, you need it, because I had no idea that 1 in every 3 women used their birth control wrong, and that half of the pregnancies that happen in North America are unwanted. So we're going to get into that. We're also going to talk about the seductive, the provocative, and the taboo. And to get the straight goods on all things sex and contraception, we have 2 health experts with her. We have Dr. Natasha Grell and Dr. Jess O'Reilly. Ladies, I'm going to let you introduce yourselves to our viewers.
I'm Natasha Grell. I'm a family physician in Midtown Toronto, and I've been at family practice for about 17 years, and I have a special interest in women's health and extra training in female contraception.
And I'm Jess O'Reilly. I'm a sexologist. I work for Playboy TV, I write books, and I travel to speak about all things sex and relationships.
And what's your book called?
First book is Hot Sex Tips, Tricks, and Licks.
Just in case anyone wants to venture into a different tab and go onto Amazon. I'm just saying, it's out there. Okay, so this is what's going to happen. We're going to open up the conversation to all of you. We want you guys to join in. Get on the Twitterverse, my people. Tweet at me at Aliya Jasmine and use the hashtag FlairSexEd. You need to use that hashtag so we can find you. Again, it's FlairSexEd. Tweet us the questions that you want to know, the ones that you maybe don't want to talk to your girlfriends about, or that you're too embarrassed to ask your doctor. Whoever you are, whatever age you are, if you're watching, send us your questions and we'll have the ladies answer it. So let's get to our first question. This one comes from at Jojo Hat. Jojo Hat says, how can I chat with my man about birth control without killing the mood?
That's a good question. I mean, my first piece of advice is to talk about birth control before you even get to the mood, right? Okay. It's a conversation. It's sometimes hard to have these really intense conversations when you're already really worked up, and when you're already turned on, you don't make the best decisions. So if possible, plan in advance.
Okay. And you know what? It's true though, right? Because women need that confidence. They can't really enjoy sex if they're worried about their birth control. So.
Absolutely. I think we think sex is this physical process, but it's just as much psychological. So, taking care of your birth control ahead of time just puts your mind at ease so you can sit back and enjoy the ride.
Nice. I like that. Okay, let's get to our next question. As we're waiting for it to come in, don't forget to keep tweeting at me at Aliya Jasmine with the hashtag FlairSexEd. This one comes from at Still Frisky. Great name. Are there less dangerous choices for contraception than the hormone-altering pills?
Absolutely, and that's an excellent question, and I think that's something that most women worry about. I've been on the pill since I'm 16. I'm now 26, not planning to have another baby for another few years. And women worry about, are there other options? And there are other options, and in particular for young women, there is a new intrauterine system, a new IUS called Jaydess. And Jaydess is a small plastic device that we insert in the uterus. It stays there for 3 years and provides safe, easy, set it and forget it contraception. And it's an excellent alternative to the pill, because what do we want as women? Do we want to have to remember, spoil the mood, oh yeah, I have to go get my pill? Do we want to, when we're traveling to another time zone, worry about, okay, well, 3 hours later, how do I set that? So this is really a great option.
The when you travel thing is a great point. When you travel and you're in a different time zone, trying to remember what time to take your pill.
You only need to go to Vancouver. You don't even need to go far, and it's totally confusing.
It's totally true. Okay, let's get to our next question. We're getting a ton in here. This is from Quaintrell by AB, who says, how does stress affect your sex drive?
Sex is probably the biggest killer of your sex drive. It's the antithesis.
Really?
Yeah, of libido. Stress not only, has such a overall impact on our general health, but it has a huge impact on why most of us are too tired at the end of the day or too not in the mood to have sex. So
see, I thought when you're stressed, that's what you want to do, is you want to get it on and forget about your stress.
Absolutely, but you don't want to initiate it. That's a lot of us, we want to get laid, but we don't want to do the work. And sometimes you can't put it all on your partner. So cutting the small amounts of stress out of your life can have a huge impact on your sex life. But you're right that sex actually reduces stress. All the studies show that our stress levels go down after sex. So sometimes you just have to push through.
Yoga and sex.
And very flexible positions.
Okay. There's that too. Okay. Oh wow, the questions are just pouring in, so we'll keep going. At SugarDoll1012 says, "What's a way to keep the intimacy there in a long-distance relationship?" This is a really good question.
Funny how we're doing this via Google Hangout.
Yeah. Do you think that like video, like Skyping?
Oh yeah. So I'm in a part-time long-distance relationship because I spend most of my time on the road.
Every guy just like started crying at their keyboard right now. He's watching this right now.
Yeah, so I mean Skype, text, leaving little sticky notes for one another, and really making the best of the time that you have together. So my rule for clients who are in long-distance relationships is handle all the practical discussions over Skype, so that when you're together, you don't have to kind of be hashing out your issues.
Right. Okay. Well, what about when you're in a long-distance relationship and you're doing this sexy Skype thing, but you might not want to do too sexy because, like, we've all heard the stories of, you know, the webcams and stuff and the screen grabs. Is there a way to kind of balance both?
Well, okay, I'll say this. Anytime you put it out there, it's out there forever. So, I mean, I can say I'm in a relationship of 13 years of marriage, so it's a little bit different. It's not as though we're just dating. But absolutely. So if you're ever going to send photos, my rule is no face in it whatsoever.
Oh,
and always work your way
tip.
up. Yeah, it's also really cool. The idea of just, you know, sending a flash shot of you, it's too much too soon. Tease a little. Send close-ups so that he or she can't really discern what that photo is. And move slowly. But yeah, no headshots.
Like the Janet Jackson circa Super Bowl of just one nip.
Yeah, but a closer shot.
Right, okay. Okay, our next question is from the Flair Fashion Facebook page, and it says, "Does birth control affect my sex drive?"
So it depends.
Oh, really?
It depends on what type of birth control you're on. Some women do complain of a change in libido with certain types of pills. And it's a bit of a hit and miss in that respect. It's really hard to predict who's going to have libido issues on the pill. And so, you know, for women who have that issue, it's always a good idea to offer other options, including something like an IUD, for example.
Okay, cool. Okay, let's get to our next question. It comes in from at Laura Sarah, who says, "What's the safest form of birth control?"
That's an excellent question, and the safest form of birth control. So let's think about that a bit. I mean, if you were to sort of think up, well, what do I want in an ideal contraception? You'd want something that you wouldn't have to worry about. You'd want something that's reversible. You'd want something that doesn't affect your fertility, so that when you're finished, you know, and you're ready in your 30s or 20s to start, you know that you're confident that your fertility is preserved. And I would say that the safest option for young women now would be an intrauterine system of some sort, of which for the above 18 age group, the Jaydess would be indicated, and for other women, the Mirena offers longer contraception, which is also reversible. And
I mean, this could be different for all women, right? So I guess go to your doctor, ask them personally.
For sure. It's, you know, it's not a one size fits all approach. Contraception is definitely something that should be individualized, and options should be discussed. Patients should be counseled, and you know, they should be aware of what's out there and make a choice from that.
I think you bring up a really good point too. It's the idea of making sure that you're still fertile and that you're okay after, because I know probably for both of you as well, but for myself, the idea of having a career and wanting to really decide when I was ready to have a family, which is something that, you know, men just are born with, and we have to actually plan that. And and you know, I wanted a career, so I think that is important to not jump into the family thing before you're ready.
For sure.
Yeah.
For sure.
But
and
when you are ready to be able to still do it.
Yeah, exactly. And so the timing is really important, because, you know, as you get older, your fertility declines just of itself, just getting older. No. I was looking at something over there. And so, you know, you don't want any surprises, because often, if, you know, we know that most women are taking the pill, and you don't want to find yourself in a situation where you don't even remember what your cycle was like. You know, I think I was regular when I was 16, but I'm not really sure what's going on now, because it's been so regulated. So, you know, I have patients who come in, you know, and not, you know, in their late 20s, and they've stopped the pill and nothing happens, no period, right? And this is, you know, this can happen with suppression of your hormonal cycle over long periods periods of time. It's not a common thing, but when it does happen, it's really very upsetting.
Is there an age where you should stop birth control? Stop taking birth control?
Women should take birth control for as long as they need it. There is no cutoff point. As long as you need it, you should have it.
Okay. Okay, let's move on. At Lisa_Kwong says, I thought that the IUS is only for women who had kids.
Right. So this is one
This is
of
what
the
I've always heard.
common myth. It's a really common myth, and you know, it's traditionally, I think this goes back to the older models of IUDs, and in which case that was true. But the newer intrauterine systems and the newer IUDs can be used are indicated from age 18, and don't have to be used in women who've had children. Especially, I like the Jaydess for younger women because it's a smaller device, it's easier to insert, it's more comfortable, and it's reversible
Smaller
in 3
sounds
years.
a lot better in that situation.
In this case.
Yes.
Yeah, absolutely. Okay, our next one comes from the Fleur Fashion Facebook page. Will getting an IUD cause weight gain? And I remember that this was something that girls in high school used to talk about when everyone wanted to start taking the pill, that it would cause weight gain. Does an IUS do the same thing?
And we've done studies looking at this, and we found that in women who discontinued the use of the IUD because of weight gain, there was actually no measurable change in their weight. So although they felt as though they gained weight, they'd actually not gained weight. So we don't think that that's a factor. I think a lot of women will have some bloating after, and that's something that's sort of transient and goes away within a couple weeks after insertion.
Okay, cool. And then the insertion, I mean, once you have it in, it's like you said 3 years, right? So
3 years for the Jaydess and 5 years for the Mirena.
So like being a bit bloated for a few days and then not having to worry about it for years is it's kind of the context.
It's a good trade-off.
Yeah. Okay, cool. We're gonna go to our next question. Sorry, my iPad is just loading. It's from @Shelly Thomas, who says, how do you keep the spark alive in a long-term relationship? So not long distance, but long-term.
Yeah, I mean, that's always the challenge, and you're always going to see some sort of a decline in the spark, but you just have to recreate the spark. I think we have this notion that you fall in love and you stay in love forever, and if you're meant to be, there will always be this irresistible chemistry between you, and that's simply not the case.
What?
I'm sorry. So the idea of a sexual soulmate, it's really a myth. It takes a little bit of work, but it's not too much work. Small things like flirting with one another, complimenting one another, being affectionate even when sex is off the table. I see this a lot with couples where they only touch when they're trying to have sex, and then if they're not having sex, they're not touching at all. Plus, it makes it a little bit predictable. Surprise your partner. They always say to plan sex and plan date nights. I disagree. I think that you should take turns doing the planning so it's spontaneous for at least one of you.
I like that idea. What about like French maid outfits? Is that not?
Absolutely. Lingerie and toys, all that fun stuff.
Pull out the tickle trunk when everything else fails, right? Okay, cool. Jess Swan wants to know, how often are couples supposed to have sex each week?
Supposed to.
So you're not supposed to have sex at with any given average. So humans are not averages. If you're really interested in the numbers, and I hate going here because I think what happens is we still all start comparing ourselves.
I want to know the stats.
Yeah,
I want to know.
Some of us
So
are
do
all
I.
like, yes, I'm above, and people are like, oh no, I'm below. It depends on your age, and it depends on how long you've been together. But if you're looking at couples in their 20s and 30s, it's around 2.5 times a week. But that's just an average. It's like saying how big our hands are.
2.5? What happens in the half?
It's half a couple. They're having it with themselves.
Oh, okay. Got it. Okay, another one from the Flare Facebook page just came up, and it says, will an IUS help prevent ovarian cancer or other types of cancer?
Right. That's an interesting question, and the IUS probably does not do that. And the reason, and this is important because the pill actually can have that effect because it does suppress ovulation. The IUS doesn't suppress ovulation. It's your follicles are still maturing each month, and so it really doesn't have any role in terms of ovarian cancer protection in particular, but that's really how we preserve fertility.
We're going to move on to our next question here, and just to remind everybody out there, you can go to the Flare Facebook page and ask questions. You can also go to Twitter and tweet at me @Aliya Jasmine using the hashtag Flair, Sex Ed. And no question is off the table, so keep sending them in. They're awesome so far. Our next one is, how expensive is the IUS? Which we haven't talked about that, and that's really important.
Right. It's important, you're right. It's expensive. The IUS systems are more expensive than, say, a traditional IUD. Traditional IUD would cost you about between 50 to 100, depending on the duration. And IUS is more expensive.
Can you just really quickly explain the difference between IUD
Sure.
and IUS?
So an IUD doesn't have any progesterone. So the IUS is really becomes a system because it has the progesterone in it, and that's a benefit. It's the having the progesterone gives you good cycles, lighter, less painful cycles. But the continuation rate for an IUS is higher than for IUD. Women tend to like it better because they don't get these heavy, painful periods that can be associated with an IUS. You know, it's cheaper than the birth control when you spell it out, because this is a 3-year investment, right? Yeah. This is not something that you have to go to the drugstore every month or every 3 months to pick up. So roughly $7 a month is what you'd be looking at for a 3-year device. Okay. Couple cups of coffee.
And would some insurance plans cover that?
This is actually the IUS is the only IUD that insurance plans will cover. Oh, they will? Yeah, okay. And so most insurance plans will actually cover it, which is good.
Oh, that's great. Yeah, that's a good tip. Okay, our next one is, why are only 1 in 3 women taking their birth control properly? I mentioned that off the top of this chat.
Right. So
like out of the 3 of us, only 1 of us would be taking it properly.
That's right.
And it's probably you.
And so people forget, you know, we're busy, we're active, we're doing lots of stuff, we're traveling, you know, you were talking about that earlier. And so we forget, and we know that the longer you've been taking it is actually the more likely you are to forget, because you get comfortable and you think, all right, and it's just a matter of that. I mean, and reminders, the other thing is that reminders don't work. So everybody comes in with their little app and it doesn't work. It doesn't help you remember.
Yeah, when you get those reminders every day, you just start like...
Yeah, you just ignore them.
Yeah. I'll do it in an hour. Yeah. And then, it's like updating the software on your computer.
Yeah.
Try me later tonight.
Not now, not now.
I've been doing it for 2 weeks. Totally. Okay, our next one is, what are some ways I can keep my man interested if he lives 400 kilometers away?
A lot of long distance out there.
A lot.
A couple of things. I mean, just talk about it. Talk about your fantasies. Ask him what he fantasizes about. Fantasy is so elemental to keeping it hot in a relationship, whether it's long distance or just long term. So talk about what your fantasies are, explore them a little, maybe play them out in small doses.
Okay, that was from @GossipHippo, so thanks for sending that in. Our next one is, I smoke. Does that affect the IUS?
No. And so this is a good option, because the association, the risk with smoking is really because of the estrogen component in the birth control. So that would be an absolute no-no, especially for a woman over 35. So an IUS doesn't have the estrogen. We're just talking about levonorgestrel, which is a progesterone. So not the same cardiovascular risk that we would worry about with estrogen. So it's a safe option for a woman who smokes and for a woman who's very heavy as well.
Is that lack of estrogen in this new IUS system, is that part of the reason it may not affect your libido as much? Because I do see clients who come in, and I'll reiterate, so I'm a PhD, not an MD, okay? But I see clients who will come in and say, you know, since I went on birth control, I've lost my sex drive. So this, and it often has to do with the estrogen. Sometimes their doctors. Can you maybe hash that out?
Yeah, sure. I mean, no, I think you're right. And also, although it does have progesterone, the hormone, it's not acting as much systemically in the whole body. It's mainly on the lining of your uterus. So you're getting a little bit absorption, but compared with the pill, for example, the pill will be about, you're talking about 13 micrograms of progesterone, compared with the pill where you can be up to 75 to 100. And so it's mainly acting on that zone on the lining of your uterus. So you're not getting as many side effects from it.
Is progesterone, does that make you horny? What's progesterone?
I think I'll pass it on to you.
No, it's not necessarily that it makes you horny.
I've never been asked that
so
question.
good.
What made you think of that?
Totally oysters in the back.
Okay. We have like 2 PhDs sitting here talking about progesterone, and I have no idea what you're talking about.
No, it's just another hormone.
It's just
but
another hormone,
tends to
yeah.
be, like, anecdotally, what I have seen with my clients is that it's the estrogen that really detracts from the sex drive.
Okay.
And because this one is estrogen free in some of the newer methods, we don't see the same impact. I don't know. Is that a fair assessment?
Yeah, I think that's
Okay.
fair.
Okay.
But, there's a placebo effect too. So if that works for you and the progesterone and horniness, then
There you go. You can find it anywhere, guys. Okay, my boyfriend says that condoms turn him off. Is that actually a thing?
Sure. I mean, anything can turn you off. The pink cushion could turn me off.
But is that like a guys with their blue balls thing? where
that's a guy thing.
I've got both of those
That's
things.
a guy
So condoms can turn you off, but does the idea of an unplanned pregnancy turn you off? Probably a lot more
For
than
sure.
a little piece of latex or they come in different materials these days.
Yeah.
But is it possible it turns you off? Yes, but you can also convert the way you think. You can retrain yourself. And it's not as though as soon as he sees the condom, he's like, oh, forget it, let's just get pizza. Right? He's just saying, no, let's do it without it. So there's always a way to get over it, especially if you have those type of hang-ups. And there are fun things you can do with condoms, and condoms are something that you may use in conjunction with something like an IUS.
And this is very common, the condom question, because, let's be honest, a lot of men don't like to use it, and they'll sort of begin the negotiation process as to why we don't have to use it.
Yeah, about it, but a lot
for
of
sure,
guys don't
for
like
sure.
to use it.
Yeah, patients will come in all the time, and that will be something that they will say. It doesn't want. He says definitely won't want to use it, and you just worry because you're already sort of in a vulnerable position. You don't want to have to be scorned or let down, and so you go ahead, and then we end up as a statistic.
So when you say that you can talk to your boyfriend and that there's fun things to do with condoms, what do you mean?
Okay.
Balloon animals?
Yeah, balloon animals. For one, you can actually heighten the pleasure by putting a little bit of lube in the tip of the condom, so that can help with his sensitivity. Obviously, there's a wide range of condoms available now that are a little bit more fun to play with, and there are fun things you can do with your mouth and the condom, and I'll leave the rest to you. And it's super easy, I'm telling you. You will not believe. I've been in rooms with 300 women, and they all practice, and they can all get it.
There are people opening tabs, Googling this right now on a separate window.
Don't Google my name.
All right. What is the secret to having the biggest orgasm of your life?
Be selfish. Women, I think, in many ways, we're socialized, or there's some, nurturing element within us that may even be essential, but we're certainly socialized to be givers, and it translates into the bedroom as well. Women are the ones buying books and reading the articles and going to workshops and learning to please their partner, but they're not doing the same thing for themselves. So be selfish, fantasize, and don't feel guilty if you're fantasizing about something that is entirely opposed to your reality. So that means if you fantasize about someone else or many someone else's, if you fantasize about acts that you would never actually want to partake in, that's perfectly normal. And then number 3 is DIY. Do it yourself. That's how most people learn how to have an orgasm, and that's how we learn to intensify them as well.
Okay, cool.
So practice makes perfect.
Exactly.
Okay, got it.
Is it true that relaxation is important for a female orgasm? Like if you're not relaxed and you can't?
100%. 100%. We always talk about surefire techniques, and I'm pretty sure on the back of my book it promises you those.
Yeah.
But ultimately, it's not just about the technique, and it's not just about the A spot, the U spot, the F spot, the C spot, all these spots that are on women that are, I know, super erogenous.
Yeah.
It's not just about the spots, it's about what's going on in your mind.
But the thing is when you want to and you want to get there, and then you start building yourself up that you want to get there, all of a sudden it's hard to relax because you don't want your boyfriend to feel like he's not doing a good job. You want to, right? And then I think that your stress level kind of goes up and you stop being relaxed.
Yeah, we call that spectatoring, where instead of actually enjoying the moment and feeling what's happening, you're almost you're acting as a spectator looking in and thinking, oh, what is he thinking, or what is he feeling, or how do my hips look, or those type of things, and that's a huge detractor. So yeah, relaxation is elemental, and that comes with breathing, that comes with pelvic floor exercises, and as you said, practice.
Yeah, and I think this is a really important conversation because women, as women, guys talk about this stuff all the time, but women don't. For some reason, there is this weird stigma around talking about female sexuality. So let's open that up. We're going to keep talking. Tweet at me, at Aliya Jasmine. We're going to talk about everything provocative, everything taboo, health, sex related. We're opening this up for all of you girls right now watching. So the next question is, What are the biggest myths about orgasms?
Well, I think there are two big things that
The question was actually, what are the biggest myths about organs? But I'm guessing that was a typo. So, orgasms.
I can answer that question.
Or you can do the organs, and I'll do
You
the
do the
orgasms. Number one is that our orgasms look like they do in porn, and they absolutely don't. I call them porngasms versus hourgasms.
Okay.
So what happens in real life often does not reflect what we see in porn, but porn is our only visual education with regard to sex, which is a really sad thing. So we think that we should be screaming like monkeys, moving around and gyrating like chimpanzees, bouncing up and down, which doesn't work for most women because it's the rubbing and grinding that gets most women off, not the kind of in and out and up and down. So that's the number one thing. I think if we can let go of our idea that it should look like porn, we'll have more genuine orgasms and more genuine sexual experiences. Having said that, if your orgasms look like a porn star's, that's okay too. But I think we need to stop comparing ourselves. We need to stop comparing ourselves to porn stars because they're actors. They're sexual Olympians, they're Cirque du Soleil performers. We are not.
Right.
So do you think it's important then to women talk to each other on that level, like to know, like, is that helpful to know what your orgasm looks like, or what?
You know, hugely, actually. I think all of us need to be a bit more honest with ourselves, but also with other people in a really non-competitive way, where it's not like, oh, I had 4
2 this week.
Exactly. Yeah. Or, oh, I hear this around female ejaculation a lot. Oh, you don't know how much I gush, and I'm thinking that doesn't make you better. I could actually, we were talking about sweating earlier off air, but I compare it to sweating. I don't brag because I sweat more than you. Right. So it's just a bodily function. So I do think we need to have these conversations in a really collaborative, non-competitive way.
It's funny though, because guys have those conversations in locker rooms all the time, and they talk about really, really detailed stuff. But for some reason, women don't talk about everything until that, and then they don't talk about anything behind. Like they don't talk about their own sexuality and how they orgasm or what. Like women don't talk about that stuff for some reason.
It's true. I don't know how intense the male conversation is. It tends to be more of a performance.
Bravado.
I think.
Yes.
Like, I got laid, and it's kind of stops at that, or she was amazing.
I challenge all the girls out there to talk to your girlfriends and talk about like your orgasm faces. See if you can be comfortable like talking to each other about that.
Let's give them ours.
Okay, well,
you first.
Is that actually it? That would be hilarious. Okay, cool. And we have another question that just came in, and it's, does getting the IUS hurt?
It's a little bit uncomfortable.
Okay.
I wouldn't say it's painful. I think most women tell me it feels like a mild cramp. And it's something that's uncomfortable for, the 50 minutes to 30 minutes after the insertion.
Okay.
On average, it can be up to 2 hours, but on average, it's about 15-30 minutes after. It's not uncommon that a woman would come in the morning before she goes to work early. I'd put it in, and then, she would function quite fine during the day at work.
And I think you mentioned this, but you don't put it in yourself, right?
No, you would bring it to your healthcare provider to put it in, because it's not something, and I'm glad you brought that up, because it's not something that's put into the vagina. This is put into the uterus. So we have to get through the cervix into the uterus.
So like further up there than the tampon.
That's right. A tampon should never be up there.
Okay.
Yeah.
Cool. Okay, so next. Did Sting really have tantric sex for 8 hours? That was via the Flair website.
Well, when I was there with Sting for those 8 hours, that's such an interesting question, and I think it speaks to the fact that sex means something different to me than it does to you, than it does to you, than it does to all of you. And so he probably was engaged in something erotic for 8 hours. I would be surprised if he was having sexual intercourse for 8 hours.
Okay.
Cool. God, I'd get bored.
Yeah.
8 hours.
I mean, unless he started singing Roxanne. Okay, so I want to, before we wrap up this conversation in a few minutes, I just want to finish off by asking Dr. Grell a question. You've mentioned a few times about the new IUS and how it just launched, and that it's a really great alternative for all the ladies out there who might not be so hot on the pill. So I just wanted to ask you if you could tell us a little bit more if there is anything that you haven't mentioned yet about Jaydess.
Right. Sorry, I think we've covered a lot of it, but to your point, because you have to understand that it's a little T plastic device. It's really quite tiny, and you bring it into your healthcare provider. We put it into your uterus. It's a little uncomfortable, but it's basically, you know, a set it and forget it thing. And you know, you're off. It provides safe, reliable 3-year contraception. So that means you're not 3 years. You don't have to worry about anything. You're done. You know, the pregnancy rates. It's 99% effective. So that is equivocal to female sterilization. So it's very effective and reliable because you don't have to do anything. Yeah, that's it.
And I feel responsible to make sure to point out though that it won't protect against STDs.
It won't protect against STDs, although the primary action is to thicken the cervical mucus. So in theory, it does make it more difficult for bacteria and semen to penetrate from the vagina into the uterus, but it's definitely not indicated for protection against STIs. That is something that you should always use condoms for. And the other thing that's important, we do. We have the yeah, the balloon animals. Yeah. I'm sticking with that. and also that it's reversible. And just because it's there for 3 years doesn't mean you have to keep it for 3 years. If you decide after a year that you'd like to start your family, it's a very easy thing to just have it removed.
What do you think is the single best reason to use an IUS versus like a birth control pill?
Well, from a physician perspective, I like the safety data. It's really very impressive. From a perspective of a woman, I like the convenience aspect of it, that you don't have to worry about anything, and that it's just there to protect you all the time.
Cool. Well, thank you so much. Thank you guys all for joining, and I want to thank Dr. Grell and Dr. Jess for being here as well. That was a very entertaining conversation with all of your questions. And you can keep tweeting them at Aliya Jasmine using the hashtag FlairSexEd, and definitely follow these two women on Twitter as well. Do you want to give your Twitter shout-outs really quick?
Sure. I'm on all social media as @SexWithDrJess.
I'm not.
She's joining Twitter later tonight.
She's not on Twitter right now,
to read your book.
She does represent your doctor, so if you do have questions for your doctor, please go ask them, and we will talk to you guys soon. Thank you so much. Thanks for coming in. Thanks for being here, guys.
Thank you. That was fun.
It was fun.